Hey, what's up, TikTok? And I guess we're winding down the weekend. I'm getting out more and more and doing the walking, but it's still like retraining myself how to walk because I'm like lopsided, and for some reason it's real easy to hyperextend my knee, so I'm just taking it slow, going around the neighborhood. I've been invited to play disc golf, but I've had to turn that down because I just don't feel ready to do that yet. But it almost feels like we're back to normal walking around the block. So that's progress, right? I wanted to make a response to the controversy over the weekend. I was responding on another TikToker's video about they had made the claim that 80% of Morgellons patients commit suicide. And so let me just clear the air. It's obvious 8 out of every 10 Morgellons patients are not killing themselves. But the origin of that statement is Dr. Ginger Savely said that her and a colleague figured it up one time, and it came out to having Morgellons makes it like 800% more likely that a person might consider suicide. Not that 8 in every 10 Morgellons patients commit suicide, but having Morgellons and going through that experience of the medical neglect and misunderstanding and ostracism and years of not having responsible treatment can make a person 800% more. And that's just her, they didn't publish that in a paper or anything. They just, kind of figured it up. Adversely, it can also make a person 800% less likely to commit suicide. Because that's what happens with trauma. Is that for some people, they deal with it one way and other people deal with it others. And, it's that fight or flight mechanism. And a lot of people, traumatic events can make them want to live more, to want to make it through, because they can see the brightness at the end of the tunnel, that there's a good ending to all of this. So there is a good ending to all of this, but Morgellons may not be the worst thing that's keeping you down right now. It could be having a hard time working, having a hard time finding work, which shouldn't be too much of a problem, but it can be, depending on what you do.